Greetings to everyone. Happy Sunday, good afternoon, good evening, good morning, whatever time it happens to be, wherever you are watching us. Welcome back to the Always a Queen, the Metamorphosis podcast for another informative and entertaining conversation. Today, we're going to be talking about ADHD. This is a topic that I get a lot of messages about, people asking questions about it. It seems to be a trending concern these days. And so I have decided that we need to have a conversation here about it. But it is not my area of specialization, not my forte at all. So what did I do? I found people who can tell you all the things. All right. So be sure to tune in. And can I suggest that you not watch this alone or listen alone if you're not watching but listening? Share this live. Call up a friend, call a family member, call up somebody who you know needs to hear this conversation today and have them listen along with you. And while you're at it, this is content that comes to you every other Sunday. I do this podcast absolutely free of cost, and I tackle topics like this one. I discuss mental health issues, personal development issues, and anything that is related to elevating your quality of life. So if this is content that is interesting to you, then I invite you to like and follow and subscribe to the Always a Queen, the Metamorphosis platforms on YouTube, Facebook, Instagram, TikTok, and Twitter, so that you can see and hear more of content like this. All right, so let's jump into what we're going to be talking about today. I'm going to give the two queens who are accompanying me for today's conversation the opportunity to introduce themselves to you. I know Dr. Paulette is not a stranger to the platform. Dr. Paulette has been here with me before for previous podcasts, but I think Dr. Chanel, this is your first time on the Always a Queen platform, isn't it?
Yes, it is.
Okay, so you know what? We're gonna let you go first since you are the newbie. We're going to let you go first. I will give you an opportunity to introduce yourself to the people. Tell them who you are. Tell them a little bit about who you are and what you do.
Okay. Well, first of all, thank you for the invitation and thank you for everybody who's joining us. My name is Dr. Chanel Joseph. I am board certified both as a psychiatrist but also as an internal medicine specialist. I studied and trained in the United States. I graduated with my training in 2017. I became board certified in 2017. I worked in the United States in North Dakota for about 4 years and decided to come back home to give back to my country. So I've been here since about October of 2021. My office offers services in both psychiatry and internal medicine. It's turned into a almost fully psychiatric or mental health clinic just because of the need, but that's just a little bit about me.
Okay. And when you say you went back home, quote unquote, we are referring to Antigua and Barbuda, correct?
Yes, we are.
All right. I just wanted to throw that because, you know, fellow Antiguan here. Hello. So, I have not followed in Dr. Chanel's footsteps and gone back home yet. We're going to see what happens. I am still living and practicing in New York State. But I'm really happy that you are home. Antigua is home to me as well, though I do not actually live there now. I am really invested in the mental health landscape in Antigua, even though I'm not there. And so I love to hear about the work that you are doing. And of course, you have my full support, 200% support in whatever I can do from over here. So thank you so much for being here today. I really appreciate it. And now over to Dr. Paulette.
Hi, I am Paulette Flores, psychologist, licensed clinical psychologist from Belize, but I currently live in Boise, Idaho. I
The
do
place
call
where
Belize
they grow the potatoes.
exactly where it's cold and they grow potatoes. Not as cold as South Dakota though, um, or any other Dakotas.
or up here where I am,
That is true.
Syracuse. Ooh, child. Mm.
That is true. I have been a psychologist for over like 15 or so years. I practice currently doing mostly evaluations. I I do mostly neuropsych evals where I evaluate for ADHD, I evaluate for autism, I evaluate for other things too, like personality disorders. And I also evaluate for just basic depression, anxiety kind of thing, bipolar, stuff like that. Um, I have been doing this for almost a year. Prior to that, I was doing military psychology, and I've also done community mental health, where I've just worked in a regular clinic in a community. So that is me.
Okay. Okay. So I'm sure the viewers and the listeners can already tell why I selected these two ladies for this particular topic. You can hear what their history is, and where their expertise lie, which is why we're going to be tackling this topic with them here today. So we're talking ADHD, attention deficit, and hyperactivity disorder. Greetings, Agatha. I see you in the chat section there, shouting out everybody. And please feel free to put any questions or comments that you might have into the chat, and I will be sure to answer them. I'll pull them up and make sure that we respond to them, or as many as we are able to. All right, so let's jump into today's conversation. Let's start at the top. Let's give a general working definition for what ADHD is. I doubt there's anybody on here who has never heard it before, but let's start off as if we're speaking to people who have not heard this term, don't know what we are talking about, and give them a general working definition of what is ADHD. Who would like to start us off? Oh, I see Chanel already unmuted her mic. All right, you go ahead.
I moved too soon. um, there are different ways to diagnose ADHD. As you mentioned, it's attention deficit hyperactivity disorder. It's defined by the Diagnostic and Statistical Manual of Mental Disorders. This is essentially, and I'm showing how thick this book is for a reason, there are a lot of conditions in it. ADHD is just one of many. This manual is reviewed every 3 to 5 years. They're currently on the 5th edition that's also been reviewed.
Mm-hmm.
So the diagnoses are updated based on scientific evidence. So because May is Mental Health Awareness Month, I just wanted to throw that in there. A lot of people here in Antigua still look at mental illness as obia or some sort of spiritual warfare, or somebody gave you something to drink. Mental illness has to do with your brain health. They've found data based on CT scans, MRIs, but there are actual studies that the diagnosis is based on, the treatment is based on. So this is essentially the guideline that tells me as a psychiatrist what ADHD is. So ADHD in previous volumes of this book used to be called ADD, so without the H, the hyperactivity. But the current classification is that it's all ADHD. The question is whether you have difficulty focusing, which is the attention part, whether you're hyper, which is the H, or whether you have both. So there are 3 types of ADHD. You can have ADHD inattentive type, where you can't focus. There's ADHD where you're hyper only, and there's ADHD where you have both. So as the name states, it's difficulty with focus, concentration, or being hyperactive outside of the social situation you're in. The thing with this, people have difficulty focusing every day. For those of us who work 2 or more jobs or long hours, you're not getting enough sleep, you'll have difficulty with focus. But this diagnosis is usually diagnosed from children. It's something that you're born with. In this manual, it's in the neurodevelopment section. So it's usually something already pre-wired in the brain. So you would notice it as a toddler, in kindergarten, in primary school. It's not just something you develop as an adult because you're overworked or not getting enough sleep. The symptoms of it have to cause you significant disability. So if you're a student, your grades are poor, you're falling behind. If you're an adult and still have the condition, your productivity at work is affected. You also have difficulty coordinating things outside of school or work, like getting to appointments on time, paying your bills on time. So it's causing you dysfunction. You're not able to have a fully productive life. So there's a breakdown in terms of how I would diagnose. I'm sure Dr. Flores has different things that she would use, but as a psychiatrist, I would interview someone. Usually my appointments are 30 minutes to an hour to gather history about from the childhood coming up. What did the parents say? What did they notice from toddler coming up? What did the kindergarten teacher say? Did the primary school teacher say you were restless, hyper? Was there difficulty in school? What were the grades like? Were they getting worse with time, better with time? These are things that help guide me to the diagnosis. And it's actually based on, as I mentioned, the criteria that's written in this book.
All right. Thank you. Hi, Monique. I see you. Just acknowledging the people who are shouting us out in the chat section. Greetings, Queens. Thank you for being here. Thank you for that, Chanel. I just want to underscore before I throw it over to Dr. Paulette, that book, that big fat book that you just held up, the DSM, right? I just want to underscore that is quite literally, like, how can I describe? That's like our Bible. That is like a Bible for clinicians who work in the field of mental health, right? That is where our clinical diagnoses come from. I just want to emphasize that. We do not make them up, okay? We do not pull them from a hat. They come from that book. And that book is literally based on scientific research on real human beings. Nobody makes any of this up. This is real. It's not obia. It's not witchcraft. It is literally a function of the brain, which is an organ just like your lungs, your heart, your kidneys, and all the other organs. And in the same way that all these other organs can sometimes malfunction, and you have to go to the doctor and get some medication to fix it, the brain can do that as well. And that book helps us to do that. I just wanted to stick that in, right? Very important to say, because as Chanel just pointed out, we do still live in a time, and I'm going to say particularly among our cultural community. And when I say our cultural community, I mean people who come from Caribbean communities, people of Caribbean descent, and I guess I could stretch it out and just say people of color in general. We still, even in 2024, struggle with accessing mental health care because of stigma, because of stereotypes, because of myths that exist, because of schools of thought that are completely erroneous. And as a result, our people suffer. So I wanted to stick this in. This is real, not a figment of anybody's imagination. Take this conversation very seriously today. Okay? All right, I'm going to get off my soapbox now, and I'm going to let Dr. Paulette jump in. Dr. Chanel already gave us a fairly broad definition. You're free to build on that if you would like to. But I also would want you to start going into some of the signs and symptoms that you see in your practice, because you are primarily dedicated to diagnosing this condition. So you can build on the definition if there's more that you would like to add, and then tell us a little bit about what you see generally in your clinical practice diagnosing people who live with ADHD.
I like where Dr. Joseph went, and I also like the foundation that you built on, talking about the fact that this thing is real. Because when we do testing, you can see that an individual who has attention deficit looks different in several different ways than somebody who is not diagnosed, right? So their ability to adapt in society, the way they might spend money, the way they interact with their friends, the way they control their emotions, right? Emotion regulation is such a big part of ADHD. Hence, hyperactivity and impulsivity. Just act, right? Before thinking sometimes, many times. We know that individuals who are diagnosed with ADHD have difficulty shifting from one topic to the next, or one assigned task to the next. Sorry. We know individuals who are diagnosed with attention deficit have difficulty planning, organizing, monitoring stuff. They also have difficulty in initiating activities. So their behavior is so much different, and it is evident when you talk with their parents, because of course you'd interview parents, you'd interview teachers, those people who are around them, their mates. Let's say if it's an adult, their behavior is different. So we know this is not something that was just maybe the person has a problem. It is evident. And as you said, studies have shown that several times. But also when diagnosing ADHD, other things that are apparent is this thing called working memory, which is when you give somebody some information, or they see something, or they read something, and you ask them 5 minutes afterwards, 2 minutes afterwards, or you have them use that information in another context, they have big problems with that. So their ability to take that information and use it in another context is it's a difficult activity for them. Sometimes it's almost impossible for them. Again, a big sign that somebody who has ADHD looks different from somebody else who is not diagnosed. Their memory also is affected, of course. So again, giving them some information, especially like kids, in school, telling them to do something, giving them 2-3 instructions at one time, right? It's a difficult task, and not just kids, adults, teenagers, whatever. So we know that attention deficit disorder looks different. I was listening as a preparation for this presentation. I was listening to this professor by the name of Russell Barkley. He is known in the field of ADHD, and one of the things he was emphasizing was just how much ADHD affects the frontal lobe, the front part of the brain, right? That's where we make decisions. That's where we problem solve. That is the area where we do things like initiate a new activity. And so many times individuals with ADHD have problems doing those kinds of things. It is evident that it is real, right?
Okay. All right. Some of the things that you are describing, I am imagining that there are people listening to us right now who are probably going like, wait, hold on. Is she talking about me? Right? So we don't want anybody self-diagnosing, okay? Please don't, just listen to the program. Don't self-diagnose unless you really feel like there is something wrong. So I just want to put a word of caution out there, because I know people might be already starting to say, hold on, hold on just a minute, right? I'm curious as to whether or not these symptoms look different based on if it is a child versus if it is an adult. What differences might one notice in ADHD in children as compared to maybe teenagers or young adults? I don't know what populations you specifically work with, but could you speak to that? Yes, Dr. Chanel, go right ahead.
So, from the manual, it also includes not only how to diagnose, but it gives you data on how frequently this occurs in children versus adults, gender differences, etc. So I'll answer your question based on information in here. According to the manual, about 5% of children have some version of ADHD, one of the 3 types. And about 2.5% of adults have ADHD. So in previous versions, previous data about ADHD, it was believed that it is something children grow out of. So by the time you hit 18 or 21, you wouldn't need treatment. They assumed it would go away. What they found is about half of the children will grow out of it, but half wouldn't. And so that's where adult ADHD became a thing. My practice is primarily adults, but I do see some children, and I have seen difference in the presentation. In ADHD, it's easier or it's more obvious in boys or males than in females. It's actually quite difficult to diagnose in females. That's because males tend to have the H, the hyperactivity part. So the mothers who are listening, if you have somebody with ADHD, can identify, the teachers will call saying they're disrupting the class. They're always moving their chair, going for something in their bag, clicking a pen, turning around talking to somebody, or their teacher's talking and they're zoned out to something outside, or they're getting up and going outside. So their behavior overall is they're not learning because they're all over the place and they're also distracting the other students.
Mm.
With focus in children, it shows up in their schoolwork. A lot of times with ADHD, you get bored with certain things. So if it is a task that a child would find boring or difficult, they tend to avoid it. ADHDers procrastinate just by definition of the diagnosis. If it's something they don't want to do, they will put it off until the last minute. And then the anxiety of that deadline sort of pushes them to get it done. So a lot of people with ADHD often procrastinate to use that anxiety to drive them to get it done, especially if it's something boring or something difficult. Sometimes in children, the assignments still don't get done. So the teachers will complain assignments are not getting turned in, or the grades are very low because they might just rush the bare minimum and turn it in. In adults, it's different. The symptoms seem to reduce compared to when they were children, but they're still there. There's usually more focus issues than being hyper in adults. So adults will tell you they go to work, they will open a tab to check their email, and then an ad will show something on the side. So they'll take up their phone and they'll Google that, and then that will lead to something else. Then they're on Facebook, and 2 hours later, they've yet to log into their email, which was the original task. It can be as bad where supervisors are now noticing it's taking you 3 hours to send an email. It is taking you 2 weeks to get what your other fellow colleagues are turning in a week or a few days. So depending on the severity of the symptoms, it can affect your ability to function at work. You may pay bills last minute because it just slips your mind, or until it takes off your electricity. It's like, oh, I forgot to pay my bill. So it can affect multiple areas of life. It is not just affecting one thing. It's focus and hyperactivity affecting all aspects of life. So those are just some differences I've seen in children versus adults, and the symptoms seem to be more obvious in males than in females.
Yeah, I have a curiosity, specifically as it pertains to you treating more adults than children in your practice in Antigua. I'm going to be honest and say that when you first told me that, I found that really shocking. I was taken aback by that. I would expect that it would be the other way around, and that you would have a practice in which you are treating more children with ADHD than adults. I am wondering, do you think that the fact that you now have such a huge adult clientele, that is a reflection of poor diagnosing or lack of diagnosing in childhood, and that is resulting in people discovering in adulthood that they are so dysfunctional that it's impacting their work and their relationships, and they end up in your office? Like, what do you think is behind this huge group of adults?
I think that a lot of people went undiagnosed, and that ties back to the stigma that's in this region. Even today in 2024, I've had people say to me, Caribbean children don't have ADHD. That's an American thing. Or they'll make it a race thing. That's a white people thing. Excuse my statement.
Oh.
And so there's a belief still, even though we're talking about mental illness in the Caribbean, we're trying to destigmatize it. There are still those beliefs. And so parents also tend to have a little bit of denial. You don't want to think that there's something wrong with my child. That's how they look at it. My child is fine. And they would quicker blame the school, blame the teachers, or blame the other parent, or blame the child themselves, than to think, well, maybe there's something going on. Maybe this child, neurodevelopment-wise, is not as everybody else and would need resources to help them. It doesn't mean that they're bad. It doesn't mean there's anything wrong with a person. We're all different. We all learn differently. This person may need extra resources that others won't. But part of why I'm seeing adults and diagnosing them as adults is because when they were children, the behaviors were looked as, oh, you're just rude and disgusting. If the teacher is saying you're disrupting the class, I can see little boys getting beaten because you're being rude in class, you're disrupting the class. Little do they know it's not being done deliberately. I saw a young man just last week, and it was clear he wasn't aware he was doing it. He rocked back and forth for the whole hour he was in my office. His mother was saying in class he just clicks a pen, but he has no idea he's doing it. It's just part of the condition. He's not doing it to annoy the teacher, to disrupt the class. It's just part of the ADHD. So I think a lot of it was just blamed on the child as bad behavior.
Yeah.
But a lot of people with Google and social media are hearing about the symptoms, reflecting on their childhood and saying, wait a minute, this sounds like when I went to school. Then they'll come and see me. We'll go over the history. And in fact, they would have the condition.
Yeah. Wow. I'm interested in hearing what Dr. Paulette's practice sees. You are in a totally different part of the world. So I'm curious to know, is it different for you? Are you seeing more adults than children as well? What is the demographic looking like on your side?
So I normally see from teens and adults. I don't normally see younger kids. But what I'm seeing is that, like for the older individuals, it's the same thing that Dr. Joseph said. They weren't diagnosed when they were younger. And what's happening is they're having difficulties at work. They're having difficulties in relationship. Because we know individuals who are diagnosed with, let's say adults, may have problems with financial management. Many times they'll have problems with time management as well. Not having a concept and an idea how long something is going to take. And so there is this frequency of being late all the time, or not getting work completed in the required time period. They might also have problems with relationships, understanding, seeing things from somebody else's perspective, but also that whole idea of how do I stop what I'm doing to dedicate the amount of time I need to the relationship that I have, especially like if you're in a relationship, spending so much time playing video games and not spending time on the relationship that you have. So time management is definitely an issue, and decision making is an issue. But I usually see adults, and those are some of the difficulties that they come in with. And when those things start to affect their everyday life, then we know that it's problematic. When it starts to affect employment, we know that it's not just somebody having problems with attention or inactivity. Another thing, again, in listening, in preparing for this presentation, in listening to Dr. Barkley, one of the things he said is that as adults, which goes with what Dr. Joseph was saying, there is less hyperactivity and more inattention that occurs. Usually kids they're more diagnosed with hyperactivity and impulsivity, but when they become adults, the diagnosis is usually for inattention. So those are some of the differences that I identified.
Okay. We have a question from a viewer on YouTube. I would like us to, I'm going to highlight it, see if we can answer this question coming from KC. And KC is asking, so how do you navigate ADHD and reduced productivity at work When your boss notices you're not being as effective, but also maintaining your privacy. So I'm interpreting this question as Casey wanting to know, how do I navigate this without having to disclose to my boss? That's what I'm understanding from the question. I believe this is what Casey means by wanting to maintain privacy, is to not be forced to disclose to one's supervisor or boss, listen, I have ADHD, as an explanation for not being as efficient. How would you respond to this question?
So the options I give to people once I've explained the diagnosis, there are two options: medication and seeing a psychologist. Here's why I recommend those two. The medication for ADHD is actually a stimulant. Think of it like coffee. So a lot of times people with ADHD unknowingly will gravitate to coffee. It actually helps them to function. In ADHD, stimulants tend to have the opposite effect. So in a quote unquote normal person, if you have caffeine, it gives you energy. It sort of makes you hyper. In ADHD, the way their neurodevelopment is, it has the opposite effect. It calms them down. So if you're having racing thoughts going from one topic to the next, it slows that down so that you can focus. Mm-hmm. But what I tell people all the time, I don't have a pill that's going to make you functional. No doctor does. I can give you a medication that can help you to focus. I can't tell you what to focus on. That's where the psychologist or therapist will come into play. For those people who don't want to be on medication, who just want to see a counselor, that is also fine. But a lot of times, a lot of people need to start with both. And then once you learn techniques in counseling on how to manage the ADHD, you can then back off on the medication. So medication doesn't have to be a lifelong thing. For people who need medication, I encourage them to take breaks from the medication. So if you work Monday to Friday, you don't have to take it on the weekend because you don't necessarily have that task that you have to focus on. In counseling with a psychologist or a therapist, they can talk to you about productivity. As Dr. Paulette mentioned, time management is an issue. So sometimes it's drafting up a schedule of, I get to work at 8, I give myself 5-10 minutes to check Facebook or do whatever I want to do so that I get that in. But by 8:15, I need to turn on my computer. At 8:30, I talk to this person. At 9 o'clock, so you have a structure, a schedule to keep to. There are apps. So everybody is walking around with a smartphone. There are apps that can help you to stay on task. You put in what it is you need to accomplish. It has alerts. It can alert you when you have time left. When you're over the time, and then you have to decide whether you go on to the next task or can you take a few extra minutes to finish it up. So these are the things that would benefit from working with a psychologist or a therapist. In any mental disorder, I usually tell people it's best to start off with both. Take a medication, do the counseling. Eventually, you can stop the medication and the counseling can continue. The reason why I recommend doing both, counseling is usually once a week or every other week. That can take several months before you start to see results. You could lose your job in between them. Or if you're a student, you have exams, you could fail between them. So the medication gives you some relief until the counseling gets to a point where it's beneficial. And then at that point, you can then back off on the medication. So for Casey, if you don't want to disclose your diagnosis to your boss, you don't have to. For people who may need to take medication. I tell them all the time, it's nobody's business but your own. You can take it at home. Your boss don't have to know. Take it at lunch. Nobody has to know. And see a counselor on your own time. There's nothing that says you have to tell anybody what it is that you're doing. So you don't have to disclose it, but the key is to do something. So I would say see a counselor, see a psychiatrist, get an assessment, figure out is your condition mild, moderate, or severe. Usually, moderate and severe will need medication for sure. If it's mild, you may be able to get away with just the psychologist and the therapist. So I would say start with seeing a professional, then take it from there.
Agreed. I'm just gonna jump in here and say very quickly that as psychologists, we work in conjunction with the psychiatrist. So I'm a psychologist. Dr. Paulette is a psychologist, and Dr. Chanel is a psychiatrist. And I feel like it's important for us to make that distinction here today. We do not do the same things, but we work together. If someone comes to me, I only do psychotherapy, also known as talk therapy. I do not write prescriptions. I am a counseling psychologist. If, when you are sitting in my office, I realize that you have a mental health condition that requires that you be medicated, I will send you over to Dr. Chanel. And she will write you a prescription, and then she will send you back to me. You see how that works? Because there are some conditions, like ADHD, for example, where you need both. You need the talk therapy and you need the medication. And so we work in conjunction to ensure that you are getting a holistic treatment for your condition. There are instances where persons only want to see me. They only are interested in the talk therapy. But the thing is that sometimes talk therapy will be ineffective. It will have no impact at all on you because of the neuroscience issues that you are facing. Your brain is just not in a position to assimilate anything I say because of the condition that you have. And so there are instances, as Dr. Chanel just said, where we have to start you off with both. You need the meds, and you can also come and get the talk therapy for at least the first few months. And then we can have a conversation about weaning you off of the medication once you have things under control to some extent. All right. So it's important to make that distinction. Chanel can talk a little bit more about her specific job as a psychiatrist, and tell you a little bit more about what she does other than just write prescriptions, because she does a lot more than just write prescriptions. But it's important because many people don't know the difference. That's just the reality. I have people calling me a psychiatrist all the time, and I have to correct them and tell them I'm not a psychiatrist. I am a psychologist. And then, of course, the next question is, but what's the difference? Isn't it the same thing? It's not the same thing. It's absolutely not the same thing, right? That's a whole other podcast, but I just wanted to put that in there, you know. I'm going to say something about the privacy part as well, and then I'll let Dr. Paulette go. Where it comes to privacy, this looks different, I think, depending on where you are practicing as a clinician. I am in New York State. And here in New York, as in pretty much every other state here in the US, and Dr. Paulette can, speak to that as well. She's here in the US as well, but in a different part of the country. There are HIPAA laws. HIPAA is the law that protects medical information in this country. And HIPAA is not to be played with. HIPAA is like a demigod, okay? You lose your license for violating HIPAA. You can go to prison for violating HIPAA. HIPAA governs anybody who works in healthcare in this country, whether you're working in physical healthcare or mental healthcare. It protects the client or the patient from having to disclose or having their information disclosed without their consent. This means you don't have to tell anybody anything. You're not required to tell your boss, listen, I have ADHD, or if it's not ADHD, listen, I have depression, and that's why I called out sick yesterday and the day before. You don't have to. You called out sick. Period. Now, what I typically tell my clients is, while you don't have to tell them, while you do not have to, sometimes it is in your best interest. Sometimes, and you and the client can determine based on their circumstances if this is the case, but there are times when it is in your best interest to just sit down and have a frank, transparent conversation with your supervisor or your boss, because that may actually result in them being more lenient and more compassionate and more gracious towards you. Now, like I said, this is situational. If you know you have a boss who's going to kick you out the job, then no, we're going to find an alternative. But so it's from situation to situation. We determine how do we handle moments when you are simply incapable of functioning at work. But the bottom line here is, Casey, you are not required to by law. You're not required to disclose anything. It's not required. Nobody can fire you for not disclosing. They can fire you for other things. They can fire you for not doing your job. But what they cannot fire you for is failing to disclose a diagnosis. That is protected information. Period. Okay? All right. I will turn it over to you, Dr. Paulette.
I would just add one other thing, that I would definitely go down the route of seeing a psychiatrist and getting a counselor or a psychologist. And the reason is because if you're having reduced productivity at work, and let's say you get fired, when you go to that other job, the problem will go with you. So addressing it and dealing with it on a personal level would be most beneficial, I think, than because what your boss says, and I like what Therese said, you don't have to disclose it, but you have to deal with that problem. You have to deal with you at the ending of the day. So I would definitely go down the road of getting assistance from both areas.
Yeah. I have another question from a viewer on Facebook. Hi, Shamara. Welcome. And Shamara is asking, is there a correlation between diet and ADD or ADHD? That's an interesting question. It's a good one. Any correlation?
That is a good question, and yes, there is. Part of what they think plays a role in the neurodevelopment of ADHD outside of genetics is environment, but also diet. Children who have a high sugar diet, and that can be junk food, processed food, soda especially, what they find is children are consuming a lot of fuel, which is carbohydrates, but they're very sedentary. And I can speak to my childhood. You were outside running up and down, you were on a bike, you were burning some of that energy off. Children nowadays are more inside because everything is on the phone. So they're on social media too early, in my opinion. There's television, especially our young boys, there's video games. And so they're consuming a lot of fuel, but it's not being used. And so it can manifest in situations like school or church where it's not appropriate. Not enough of the micronutrients. That's part of the brain development. The B vitamins are very important for nerve and brain health. All of the B vitamins, and they have a lot of numbers: B1, B2, B3, B6, B12. They're all good. But those are primarily in fruits, in vegetables, the bright colored foods on the edge of the supermarket that tend to cost a lot of money but have all the nutrients that you need. So children will run towards the center of the supermarket where you have the chips, the soda, the candy, diets high in those things and not enough of the fruits and vegetables can play a role in the neurodevelopment that's already there manifesting or being worse. So reducing the sugar content in someone who has ADHD can play a role in helping to control the symptoms, may even get you to the point where you don't need medication. So that's one of the lifestyle choices you can put into place that could help.
All right. Are there specific dietary requirements, supplements, etc., that you might refer for a pregnant person? So they don't have the child yet. So the child isn't really out there consuming all the sugar and the soda yet. They are expecting a child. Should the expecting mother be staying away from some things and eating more of certain things and taking more of the B1, B2, and all the Bs down the line?
And that's a good question. So the child's health begins in the uterus. So even before, as you said, they're eating the candy and the chocolate and the chips. If whatever mom consumes, baby is consuming. It's very important to make sure you're taking your prenatal vitamins. Those contain all the B vitamins and folic acid, iron, all the things that the baby needs to develop, not just physically, but the baby's brain health. But mom's diet is also important. So mom needs to eat the fruits and the vegetables, the healthy proteins, the good fats, which is in nuts, in seafood, the fish oil. That's the healthy fat that makes up the brain, that's part of the brain health. Avoiding the bad fats, so the fried stuff, because that actually interferes with the healthy fats that your body needs. So it's important that mom eats well from the baby is in the stomach. That helps with the neurodevelopment. So all the chemicals in baby's brain go to the right place to reduce the risk of developing any mental illness. But that being said, you could take all the vitamins, you could get the right amount of water, eat the right amount of protein, healthy fats, and a child could still have ADD, ADHD. There's more that plays into it. The habits that you have. Are you somebody who drink alcohol? Do you smoke marijuana? These are all chemicals that affect where our brain chemicals are. So if mommy is consuming that, it's affecting baby's development. The other thing is genetics. If you have ADD or ADHD, your child is predisposed to it just from a genetic component. We're made up of different components of our parents. There's nothing we can do about it. So mom can do all that she can do, but if mom has the condition, it's possible, it's not a guarantee that the baby may inherit that gene. So there's some factors that you can control, like substances that you use, diet, physical activity, but there's some that you can't, like genetics. So you can reduce your risk. You can't 100% prevent something, but you just control the factors that you can.
Okay. Dr. P, do you want to add anything to that, or should I move to the next question? Because we have another question. The questions are coming in fast and furious in the
I think
chat
we should
section.
move, I think the psychiatrist did a very thorough job on that. We could move.
Okay, let me pull up. I have another question here waiting. Now this question I think the both of you can tackle. Um, from Trinity, who is listening to us on Facebook. She says, "Good evening, aspiring clinical psychologist here. Yay! Do you, Dr. Chanel Joseph, also prescribe medication for depression and anxiety? If yes, would you have to receive a referral from a psychologist, or do you have to do an individual assessment before administering the medication?" Um, I'm gonna, I think the process might look different depending on where you are. So let me let Dr. Paulette respond first. And Dr. Paulette, incidentally, is a clinical psychologist, Trinity. So it's a good person for you to talk to. What would the process look like in Idaho? And then Dr. Chanel can say what it looks like in Antigua. Because I suspect it probably doesn't look the same.
So in Idaho, medications for depression and anxiety are normally given out by the primary care provider. You go to the clinic, your medical clinic, and
That's your doctor.
Your doctor gives you medication for depression and anxiety. Usually, it is not. You don't need a referral for that. What many primary care doctors would do, they would make a referral if like it becomes complicated. So you have depression, you have anxiety, you have ADHD, and you might be on the spectrum as well. Then the primary care doctor will say, you know what, that's like too much for me to handle. But for the most part, depression and anxiety, usually it's the primary care provider who does that. And then if an assessment is needed, usually the assessment, like if somebody is referred to me for neuropsych testing, it is usually because it's more than just depression or anxiety. Several other things are going on, and they want to tease apart, they want to rule out certain things.
Mm-hmm.
Yeah. So depression and anxiety, the primary care doc.
Okay. All right. Chanel, what is the process looking like in Antigua? How does it work?
So, to answer the question, I do prescribe medication for depression and anxiety. The process varies here. So, it's different from what Dr. Paulette described. I'm familiar in the States. Usually, someone will see their general doctor and be tried on a couple of medications before they get referred to the psychiatrist. In Antigua, it's different. A lot of general doctors are not familiar with the mental health medications and will flat out tell you they are not prescribing it. You might find a doctor that might give you a 1 month supply, copying off of another prescription. If you really beg and plead with them, you can't find your doctor. But most of them wouldn't start a medication or try a medication, they'd refer you to a psychiatrist. I do not have to get a referral from someone coming to get treated for depression or anxiety. The process in my office is that someone would be seen by my social worker, Ms. Peters, first. She will do an initial assessment, gathering some of the history, getting an idea of what is going on. I will then talk with her. Based on that assessment, I could probably give you a medication and then schedule you to see me. So by the time you see me, I can then get an idea of how things have changed. And I sort of came up with this process because in Antigua, there are only 2 psychiatrists, myself and Dr. King. And so there's a long wait time to get in. So this was a way to try to get people in, get people on medication or referred for counseling quicker than waiting 1 to 2 months to see me. So the process probably varies for Dr. King. I'm not familiar with his procedure, but that's how it would work in my office.
Right. Yeah. Okay. And in my office, in my office, and I am in New York, so we're getting a view of what it looks like in a variety of places. So here, as I mentioned previously, I do not prescribe medication. Um, I write a lot of referrals, however, for persons who I realize need the medication. I write referrals to psychiatrists all the time, um, referring the person. Usually, I would send the person over to a psychiatrist if that person needs not just medication, but also they need an assessment that I cannot provide, because the psychiatrists sometimes do assessments that I don't do, right? Or I might send them to a clinical psychologist like Dr. Paulette, who specializes in doing assessments. And I recognize this person needs to be assessed. I am seeing all the symptoms in front of me, and this is an assessment I don't do here. I send you over there to get assessed. And so I may send you to somebody who can assess you and write your prescription. One go. That would be the psychiatrist. Not everybody needs a full-on assessment. I would have already assessed you here in my office, and I have already looked at my DSM. You meet all the criteria for clinical depression, for example. I don't have to necessarily send you to get assessed. I'm just sending you to get medication. I write a referral then to your PCP. That's your primary care doctor. And the primary care doctor, based on my referral, will write you a prescription for whatever psychotropic medication I have recommended based on the symptoms that you presented in my office. And that's kind of how we do it here. So you don't necessarily always have to go see the psychiatrist. The primary care doctors here, unlike in Antigua, they have no problem with writing prescriptions for psychotropic medications for depression, for anxiety, for bipolar disorder, you name it. I just send a referral, they write a prescription. Some of them will even write the prescription without a referral if they are able to see the symptoms themselves. If you go to your primary care doctor and you're going just for your regular annual checkup, and they see signs that you are clinically depressed, they're not just going to overlook it. They're gonna assess you, and you probably will walk out of there with a prescription for the depression. So the system looks a little different over here. I think that there is a better, how shall I put it, a better network of clinicians working together in both mental and physical health. Like, they are networking. There's a system in place. So when you come to me, I can look at the records from this other person that you saw and this other person that you saw, and I have a more global perspective of what is going on with you. And I think that is why our primary care doctors, for example, are comfortable with just writing your prescription. So maybe one of these days when I move back to Antigua, we can set up a system like that. someday. Okay, let's go back. I'm going to pause on the chat section for a moment and go back to our conversation. I wanted to go back to something that was said earlier about the fact that ADHD is much easier to diagnose in males than in females. That's very interesting to me, because I don't think it's because more males than females have ADHD, is it? They probably have, it probably shows up in the same amounts in both, but one group gets diagnosed much easier than the other group. Can you speak to that? Why is it hard to detect in the females?
So it's harder in the females because females tend to have the inattentive component more than the hyperactive component. Men or little boys tend to have the hyperactive component, and that is what gets the teacher's attention, the parents' attention, to figure out to say, well, okay, something needs to be assessed. But in females, you're not really hyperactive, you're just not focused. A lot of times you might be seen as quiet or reserved or introverted. You're just not performing well. And so the little girls or women are more, it's more, we get blamed. You're not doing enough. You need to study more, as opposed to you're having difficulty focusing. So I believe the thing that distinguishes the genders is the hyperactivity, which is more common in the males.
Okay. Dr. Paulette, do you have more female clients or patients than males?
I have, I would say, more females. More females coming in. And of course, it kind of goes back to that whole thing where women kind of are more in charge of the health. Women just, we kind of
They're
track
more
things.
likely to go see a doctor.
Exactly.
Yeah, we know.
But I do agree with that, where little girls are more inattentive. Like I've tested a couple young ladies, and it's usually inattention. I've treated little boys, and it's usually hyperactivity and impulsivity, jumping on the table at school, or just being, getting into fights. While the little girl is more, or the young lady is more reserved, there is less of that acting on impulse.
Okay. While you're on the mic, Dr. Paulette, I'm going to ask a question about diagnosing and assessment. Can you speak a little bit about the assessments that you use in your practice to assess people, like the actual testing that is done? Can you speak a little bit on that? And is it common for people to self-diagnose for ADHD?
Oh yeah. People self-diagnose all the time, right? But let me start first with why diagnosis is important. So there are some aspects of ADHD that can be found in several symptoms of ADHD that can be found in other disorders. And so going to a professional who is trained in that area is recommended, so that you could rule out those other things, so that you could identify that it is not bipolar, or it is not autism. The person is not on the spectrum. By going to the professional can tease out those other things. You saying that you have these things and that you need medication for it, it does not, you're not taking everything into consideration. You're just taking a couple of things. Like one of the things you said earlier, Teresa, is that maybe some people are thinking, man, maybe I have ADHD, right? Based on some of the things that we were saying. And all of us have difficulty sometimes with time management at times, or we might have impulsive behaviors at times. But one of the things that makes something a diagnosis is how long has it been going on, how impairing it is, and how many different aspects of your life is it affecting. So if it is not affecting several different aspects of your life, maybe it is not ADHD, maybe you're just having problems in that particular area at that particular time. Maybe it's very situational why you're having those particular issues. So going to a professional makes a big difference. What are some things that in evaluating and assessing somebody that I look for? So normally I would look at one's cognitive functioning. So I would give like an IQ test, whereby many times when giving an IQ test, an individual with ADHD may have problems with working memory. How easy or how difficult is it for them to keep information in their mind and then use that information in another context? Do they forget it, or they just have no idea of how to manipulate that information. So cognition, we also look at adaptive skills, which looks at one's capacity to function in society. How well are they doing self-care? How well are they taking care of money, like financial academics? How well are they their leisure and social activities? Do they spend most of the time by themselves locked up? So we look at cognition, we look at adaptive skills. We also look at social skills. How well do they interact with others? Also, in evaluating for ADHD, I also look at achievement skills, right? So I would look at their math and their English and just give them simple assessments with those. So we've said cognitive, we said adaptive, we've said social skills. We also look at behavioral skills like personality, because sometimes personality becomes a big part of ADHD as well. So I would look at personality as well. So I would give them like a personality assessment as well. I might also still go ahead and give them something else too for personality, because one of the things we've noticed is that ADHD sometimes has like a bipolar flavor to it. So you want to tease apart, is it ADHD? Is it bipolar? Is it a combination? Or just so you want to get a better feel of that. So there are several components that are tested before you come up with a diagnosis. So one screener does not allow you to be diagnosed with ADHD. Especially when people want to self-diagnose. I went on the internet and it said that I have ADHD. They do one assessment and that gives them several things. You look at several, and one of the things you also talked about is getting information from the psychiatrist, or getting information from the primary care doctor. That information as well is added. So an interview is done, a clinical interview is done. Also getting information, collateral information from somebody who knows that person well. They've known them for a while. Say more about their behavior. One last thing that I was forgetting that's so important when you're testing for ADHD is looking at executive functioning. How well does this person make decisions? How well does this person initiate, organize, plan? Very important.
Okay. All right. Thank you for that. I have another question. Let me pull up this question, and then we can continue with the conversation. Casey is asking, what type of techniques would be used to help manage ADHD outside of medication? For example, are there cognitive behavioral techniques that can help manage the ADHD? Anybody want to jump on this one?
So I could jump on that one, because there are several techniques that can be used. I like the idea, as Dr. Joseph said, you start with medication first, because what that does is that in regards to time, especially if you have to, you're going to school and you're going to take a test, getting those symptoms under control is helpful. But other things that you could do, like behavioral strategies, could include trying to take away time from the activities, especially in the beginning, because many times time is an issue for individuals with ADHD. So removing, and that's one of the reasons why sometimes people or kids going to school are put on like a IEP or a 504 plan. Of course, the IEP is the individual
education plan.
Yes. So the IEP might say give the individual more time to get stuff done. So removing time from the task. Another thing too is attaching rewards to activities. If you get this done, this is what's going to happen. But remember, we have to hold individuals with ADHD accountable as well. Not because we know that it's a problem and it's affecting their functionality that we're going to say, well, I'm going to allow you to get away with it this time. We have to hold them accountable. As soon as something is done, they have to be held accountable for it. So, which goes to the other recommendation, which is the immediacy of consequences, right? Both positive and corrective consequences have to be dealt with, or issues have to be dealt with immediately. You were told that you need to get your homework in this time. If you don't, we've discussed the consequences. This is what's going to happen. And the consequences, of course, don't have to be like severe, but at least have an understanding of what that is all about. Other behavioral strategies can also include changing the rewards periodically, because of course individuals with attention deficit get bored with things very, very easily, and so changing the reward, so it's not the same thing that you gave last week, you might give another time, and kind of incorporate what they would like into the activities as well. What would you like as a reward? What's going to be interesting for you? I heard today too, like there is this 7-3 rule. So you have them do homework for 7 minutes and then 3 minutes, give them a reward. Occasional and frequent breaks. Sometimes when a kid is not doing well in school, the teacher is going to take away break time, which is like the worst thing you could do to somebody with ADHD, right? So that's like setting up yourself for things to go really, really bad. So parents can actually, have them do something and then give them a reward, give them a break. So occasional breaks make a difference. So one of the things we know about ADHD, kids know, or individuals know when things are not working for them, when that they have a problem, but it's actually implementing it that becomes the issue. It's the implementation of it that's most problematic.
Yeah, I like that list. You said all of the things that I would have said, all of the recommendations that I would have made. The only thing that I would add to that is something that that Chanel already mentioned, which is use the technology that you have available to you to help you. Many times we do not use our technologies for good. We're using the devices to engage in behaviors that are really not beneficial and that are actually detrimental, particularly if you are a person who is living with a mental health condition. Those devices, those smartphones and tablets and computers can be so helpful if you make use of them. You are literally traveling with help in your hand if you choose to access it. The apps that you can download now are absolutely marvelous. You can download apps that hold you accountable. You can download apps that help you manage your time. You can download apps that give you breaks, as Dr. Paulette was just saying, so that you can reward yourself. Those pleasure centers in your brain light up when you are able to complete a task and receive a reward for it. It makes a difference for somebody living with ADHD. You can also use those same apps to keep a little journal, like a little electronic journal of days when you are doing well versus days when you are not doing so well, so that you can track patterns to see which days you seem to be struggling to manage your symptoms versus days when you are managing your symptoms very well. What's happening on those days? Is there something that I need to cut out of my routine? Is there a habit I am engaging in that seems to be setting me back instead of moving me forward? Like little patterns like that, you can track with an app. So make the technology work for you, because I have found it very helpful with clients that I have worked with. And another thing, one last thing that I would add with regards to that is that family members, partners, spouses, all of the people around you need to be on board with this agenda. It's very, very important. These people, the people who are in your close circle, can make or break your success where it comes to managing mental health conditions. And this does not just apply to ADHD. This applies to any mental health condition that you are trying to manage and successfully live with. Because there are people all around us who are living very successful lives, highly functional, and living with conditions, and you have no idea. Because it is very possible. If there is good medication management, if they are getting good psychotherapy, and they are able to stay on top of things, they will be out here thriving, and you don't know that they're living with a mental health condition. And that is possible for anybody with the right help and under the right circumstances. And a key part of that is having a supportive network of people around you. If your partner, your spouse, the people in your home, the close friends that you are spending most of your time interacting with, if these people are not supporting the life you are trying to build for yourself, you're going to have a problem. That's just, there's no other way to put it. I often recommend that families be in therapy when they are trying to be there for somebody who is living with a condition like ADHD, like bipolar disorder, like very severe clinical depression, anything that is going to require a lot of a life adjustment, because the condition comes with behaviors that can be very disruptive to one's life. When you are living with conditions like those, you need supportive people around you. Hands down, your relationships can make or break you when you're trying to live a healthy life. Okay, super important. Dr.
Can I? Oh, I was just gonna ask. Can I add one other thing?
Yes.
I like the idea too of the family. And you could ask family members to hold you accountable, especially with ADHD. There is impulsivity, there is inattention. Asking someone to hold you accountable. By next week, I need to be finished with this, or by the ending of the day, this is just reminders of getting stuff done, especially since that particular diagnosis comes inherent with problems getting stuff done. Yeah.
Dr. Chanel, did you want to add anything to that question?
No, I think Dr. Paulette explained it quite well. One of the techniques that she mentioned that I've had feedback works very well is the duration of doing something and then taking a break. In fact, there's something called the Pomodoro technique. Usually it's working for 25 minutes, then you take a 5-minute break. I recently bought a laptop and that's built into it. It actually asked me if I wanted to set it up where it would, I guess, alarm or alert me after 25 minutes of doing whatever the activity is to take a break. So if, depending on your job, it requires a lot of sitting, staring at a computer screen, for example, and you get bored and will then start to lose focus, you can set that timer where after 25 minutes you get up, walk around, take a break, even if it's something on your phone, then go back to work. I don't think that would cause much disruption in your job. It shouldn't be that obvious to anybody. We should be getting up and walking around more throughout the day anyway. We sit too much. So I would just say, of all the things that Dr. Paulette mentioned, that is something I've gotten feedback on that works really well.
Okay. Any app recommendations for Casey? I can recommend one that is called Inflow, that I have clients who use that. Inflow. It's free to download, but It does require a subscription, a monthly subscription. And I think there are different monthly subscriptions depending on what you want the app to do for you. And it's available both for iPhone users and Android users. It's called Inflow, INFLOW. There is one that's one that I have clients who use, and I also have clients who use another one that is called Will. Focus Will. Two separate words. Focus Will. This one is also free to download, and I think that there's a free trial that you can use. But then once the free trial is over, you will have to get the monthly subscription. They all have a monthly subscription, but they're not expensive. They're like $7.99, $10.99, and also this one is also available to both Android and iPhone users. And there are others. That you can find. Maybe you can just like do a quick Google search, but those are the two that I know of. But you can do a quick Google search and just type in best apps for ADHD. And depending on whether you're an iPhone user or an Android user, you could add to the search and say best apps for ADHD on Android or on iPhone, and then you can test them out. I would go for the ones that have a free trial first. Give it a little test run, see how it works for you, see what is the best fit for you, and then decide which one you would like to have a subscription for, before you swipe your card. You know what I mean? Because you want to make sure that if you're paying for it, that it's actually working for you. But I think it's an absolute worthwhile investment. So don't think, oh my goodness, I'm going to have to pay for an app. Nobody wants to pay for apps, but this is worth it. Where your health is concerned, absolutely worth it. I don't know if Dr. P and Dr. Chanel have any app recommendations. Do you?
I don't have any. And I was just looking at my phone to see if there are any there. I see several, but I usually like apps that somebody has recommended before rather than just going to go get an app. And I like the idea too, just doing a search and seeing what comes up as most effective for people.
Mm-hmm. Yeah, there are a lot of them.
If you go to the App Store and type in Pomodoro, 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 there are apps that have the 25 minutes working, 5-minute breaks, but they're also based on ADHD and ADHD techniques. So it will be a timer, but there'll be sections where you can journal. There are sections where you can create task lists, to-do lists. You can set times on those. So usually the apps that deal with the Pomodoro technique are geared towards ADHD. It's just finding the one that works best for you. So I would give that recommendation as well.
Mm-hmm. Yeah, that's good. That's good. Okay. Let's start winding down. We are already an hour and a half in. See how the time just moves quickly here? So let's start winding this up. I want to ask about comorbidities because that came up earlier in our conversation, but we didn't stay on it and speak too much about it. We just kind of glided past it. But I feel like that is important to touch on. For anyone who's listening, comorbidities, that's just a big fancy way to say 2 or 3 conditions that may be existing side by side in the same person. So you have ADHD, and you also at the same time have bipolar disorder, or you have ADHD, and at the same time you may be on the autism spectrum. Those are comorbidities. I would be interested in hearing about common comorbidities that exist in persons living with ADHD, and if there is a difference in children versus adults.
So clinically, that people that have come to my office, what I've observed, along with the ADHD, the two most common are depression and anxiety. And if you think about how ADHD can negatively affect you, you can see how someone can get depressed or anxious. As I mentioned before, ADHDers tend to procrastinate, wait until just before the deadline, and then the anxiety of I have to get this done gets them to get something done. That procrastination can also manifest in a very overwhelming to do list. And so, yes, you have some anxiety to get you to be productive, but here you now have a long list of procrastinated tasks. Which one do I start with first? Which is the most important? You may start with something that really should have been at the bottom of the list, and now the thing that's at the top of the list has now gone past you. And if that's your electricity bill or an important doctor's appointment, you can see how it can cause some anxiety. Because ADHD, there's poor time management or poor appreciation of time lapse. They're not doing it on purpose. It's just they go to do something, it's 2 hours later, they haven't started, and they have no idea where the time went. Lack of productivity, that feeling of I'm not performing well, I am not at the same level as my peers. It can lead to low self esteem, poor self image. You start to question, what am I even doing? It can spiral into, I'm better off not being here. So it can quickly develop a depressive episode, and that can lead to thoughts of death and suicide. So the two most common things I've seen are depression and anxiety with the ADHD. What I tell my clients all the time, let's treat the ADHD first. Almost always treating the ADHD, the depression, the anxiety themselves improve.
Kind of
Because
go
if
away.
you're being productive, if you can focus, you feel better about yourself, that improves your mood. You're not as anxious because you're getting stuff done. You mentioned autism, and I wanted to explain on that. It's very, very common for someone who has autism or what is called autism spectrum disorder to have ADHD. They are not one in the same. You are not guaranteed to have ADHD if you have autism. ADHD is just one of the disorders or conditions you can have with autism. So if someone's diagnosed with ADHD, usually the second or the third visit, they'll come for a follow up and say, so does this mean I have autism? And so that is its own chapter, its own section in this big book. So I would then have to redo the history, go back to the childhood and ask some questions specifically to autism. Autism spectrum disorder can have other conditions with it. ADHD is just one. Individuals with autism can also be depressed. They can be anxious, specifically an OCD, where they have obsessions. It could be with numbers, could be with colors, could be with rituals. Sometimes you can have defiant behavior. Individuals with autism can have sleep problems. So there's a whole cluster of conditions that can travel with autism. ADHD is just one of them. So I wanted to clarify that because a lot of people think once they get the diagnosis of ADHD, I'm autistic. That's not necessarily the case. There are several people with ADHD that do not have autism spectrum disorder. So I just wanted to clarify that.
Okay. All right. Thank you. Dr. Paulette, you want to add something to that?
I would add, so I with ADHD definitely I would I've seen individuals, many of them have anxiety as well. Bipolar seems to be, I think it is many times with testing, it is one of the what we would call like a differential diagnosis, because sometimes ADHD has a look like bipolar has a look like ADHD, simply because of that hyperactivity sometimes that is apparent in individuals who may have ADHD. So, I know you were asking about comorbidity, and I went into differential diagnosis.
That's
But
okay. That's okay. No, they go together though. They go
yeah,
together. Yeah.
and they look so similar, and so sometimes that's one of the things to tease apart. Another thing that's usually sometimes individuals with ADHD are misdiagnosed is with oppositional defiant disorder, and it's
Mm.
just that the individual has difficulty maintaining or self-regulating, or they're oppositional, or they have problems following rules, and so they come across as being very oppositional, when in actuality it's just the hyperactivity is out of control, the inattention is out of control, the irritability is high, and so you come across looking like, I'm gonna just fight you all, and this is gonna be bad, So, so those are like two other diagnoses that I've seen. Looks or individuals with ADHD are mistakenly diagnosed with those other things. And this morning, as I was looking at, as I was researching, I noticed that one of the things said is that 40 to 60% of individuals who are diagnosed with ADHD are actually on the spectrum. So the numbers aren't as high as we think they are, because as Dr. Joseph was saying, many times people are saying, hey, I have ADHD. Does that mean I have that I'm on the spectrum? It's just 40 to 60%.
Yeah. You just said something there that has me thinking, the misdiagnosing of people with ADHD. Is this something that is happening a lot? Where people who have ADHD are diagnosed with something else and don't realize that what they have is actually ADHD, and maybe even medicated for something else? Is this a frequent occurrence?
I'm not sure how frequent it is. I have seen a couple of cases, as Dr. Paulette was mentioning, bipolar disorder can be, there are features that are similar. So in both conditions, the hyperactivity or impulsive behavior is similar. With bipolar, individuals tend to have trouble sleeping. ADHDers tend to be night owls. They tend to have more energy, be more productive at night, and have a preference to sleep during the day. So there's things that can be confusing if you don't take the time to clarify the diagnosis. And then it's a double-edged sword. If you're treating ADHD as bipolar, they're not going to get any better. If somebody's bipolar and you're giving them a stimulant, you can make them manic. So this is why it's important to clarify the diagnosis, because somebody can be going untreated or getting a medication they don't need, or you can make what they're struggling with worse. So that's why it's important to start with, this is what I do. I take time, I ask a lot of questions, because the first question I have to answer is, what is it? What am I looking at? From there, I can then give recommendations as to how to treat. Could be medication, could be counseling, could be both. If medication is needed, what type of medication? Some conditions need an antidepressant. Some needs an antipsychotic. Some need both. Some need a stimulant. And if you do the wrong thing for the wrong condition, you can make the person worse. So that's why it's important to make sure you're operating with the right diagnosis from the beginning. But I'm sure misdiagnoses have happened. I'm just not sure how common. I'm not sure about Dr. Paulette in her area, how many cases she's seen.
I really appreciate what you just said about what can happen if the individual is given the wrong medication, because I think that's one of the things. Many times people just say, well, I have ADHD, I filled out, and then they go to their provider and the provider gives them some kind of medication as well. So I like that you reinforce the idea that this thing can have unhealthy effects on you if you take the wrong thing, you know. Um, Again, on my end, I can't say that I know what the numbers are in regards to misdiagnosis. Um, but I know that misdiagnosis can have effects on your functioning. Putting you in a manic state is not always the best thing, or is never the best thing, you know. So I like that Dr. Joseph reinforced that.
Okay. All right. So the last and final item on the agenda for today, to close us off, is I wanted us to leave our listeners with a few tips. Any tips that you might have for whether parents or children or adults living with ADHD or caring for someone with ADHD? Do you have any final tips that you might want to leave them with that we have not already shared, just as a closing out?
I wanted to, you know, as I was looking at ADHD, one of the things that happen at times is that parents parents have a hard time, because parents are the ones who have to try and help kids manage. First of all, learn about the disorder, then teach a child about the disorder and help the child manage those symptoms. And there are times when ADHD becomes, especially when it's severe, when kids are suspended. Many times when you're interviewing somebody for ADHD, ask them how many times they've been suspended from school. Some kids have, and it starts from like when they're like in pre-K or in kindergarten. Many times you ask the parent, when you look at the child's history, and the child has been suspended like several times or expelled from certain schools, right? So the idea of forgiving yourself, you the parent, forgiving the child, and just knowing that you're going to make mistakes along the way as you're finding what works, what doesn't work. As Teres said earlier, don't try and do it by yourself. Get the support of family to get this thing done. And I want to add one other thing. If you're concerned about the child's behavior, you're worried, see the psychiatrist, or see a psychologist to be evaluated. Even if it's not an in-depth evaluation, at least start the process so that you could get the help that you need. We know that with medication, a lot of the symptoms for ADHD can be controlled.
So, just to piggyback on what Dr. Paulette said, and what I'm about to say is specifically for individuals listening from my region in the Caribbean, I want to speak to the old-fashioned way of thinking. Because as I mentioned earlier on, someone said as recent as last week to me that ADHD is not a thing. Caribbean children don't have that. They have it classified as an American thing. We need to acknowledge that mental health is something that needs to be addressed. It's not something to dismiss or ridicule or turn a blind eye to. And ADHD is something that is usually diagnosed in children. It begins in childhood. Individuals in first world countries, US, Canada, UK, they're taking their children in to be evaluated. They're getting them to the counselor, getting them on medication. And I tell parents, don't allow your child to struggle. While other people are getting help, don't let pride and ignorance hold you back from getting your child evaluated, getting them the resources they need to be productive. Because a child that's struggling academically, we talked about depression and anxiety as comorbidities, that can carry on into adulthood. You have them feeling that they're less than, that they're worthless, that they're not intelligent. That can affect their productivity, what they pursue as adults. So, a small intervention in their childhood can have a major impact. Don't allow children to struggle. Even if you have reservations about medication, as I said, I primarily see adults. In children, I try my best not to prescribe medication, but if your child is getting suspended, as Dr. Paulette said, if they've been expelled from 2 schools, they're now on their third one. If every school they go to, their peers are advancing and they're being held back, then it's an indication for medication. Counseling by itself is not going to be enough. So I just want to assure people that there are resources available. If you have concerns about your child, if your child is struggling, don't allow them to turn into less than functional adults. Bring them to a psychiatrist, take them to their pediatrician. Pediatricians can also diagnose ADHD so that they can get the resources. I know there's schools in Antigua that have programs for children with ADHD. So whether it be more time on tests, whether they get a tutor, there's different resources available. But giving a child what they need to be productive and successful, there's nothing wrong with that. There's nothing that says every child must go through school by themselves without any assistance. We need to advance in the way we think here in this region, and we need to get our children help before they seek it out themselves, because they're getting into the wrong things. They'll follow the wrong crowds. The children here are getting into marijuana and all that they're putting in it. So you can see how this can escalate very quickly. So I would just encourage somebody, hopefully you've learned a bit more about ADHD. It's not fatal. It's something that can be managed into adulthood. But intervening for your children now can make a big impact on them as an adult. And for the adults who are listening, if you suspect that you have ADHD, as Dr. Paulette mentioned, reach out to a professional to get an official diagnosis. A lot of people are just clicking on a web page on Google, self-diagnosing, and then if you take that to a doctor who will then treat you out of context, it can go badly. So seek out help. Don't wait until your supervisor or something is happening where it's now getting into the public. Intervene before it gets to that point. So hopefully somebody has learned something and will make that effort to get the help.
All right. Okay. And this brings us to the end of today's conversation. This was really good. Like this felt like part one of something that needs to continue. It's what it felt like. I don't know how it felt to you, but we're gonna see. Thank you so much, ladies. Thank you. I truly appreciate not just the time, but the wealth of information that you shared with my listeners and my viewers today. If there's one thing that people can say about this podcast, if you tune in, you're going to learn something, right? And today was not an exception. Thanks to you two phenomenal clinicians. I also want to thank you, in addition to thanking you for being here and sharing today, I want to thank you for the work that you do. Thank you for the work that you get up and do every single day of your lives. You are changing the world. For real. And we appreciate you. I appreciate you, and I know the people that you work with and the lives that you are impacting appreciate you too. You are leaving a legacy, and the Always a Queen, the Metamorphosis platform just became a part of your legacy that you're leaving behind. And so we appreciate you here. Thank you so much, and you're welcome back anytime. All right. And on that note, I see people in the chat section. Listen, y'all need to stop. We're done. Agatha says, Very interesting and informative. No, I absolutely agree. She's calling up. She said there's always a part two, right, Therese? I mean, not always, but sometimes, if it's nice, you do it twice. Right? But I want to thank you. Thank you all very much. Thank you to all of the listeners, the people who were watching us and listening to us across the platforms. Right now, we are live on Facebook, we're live on YouTube, we're live on Twitter, and we are live on Instagram. So we have people watching us across all four platforms. And you know what? Let me also give a shout out to the people who are going to be watching this in the future. Thank you to the people who are here watching us live right now. But this podcast is being recorded and it's going to be on all of the platforms, and people are going to keep watching this into perpetuity. People are going to be watching this recording and sharing it. And so if you are watching this at some point in the future, thank you for being here. Thank you for supporting the Always a Queen, the Metamorphosis platform. Keep coming back for more of this kind of content. We are here to support you. Thank you to everybody who has been interacting with us in the chat section, all of the questions, all of the comments, and the comments are still pouring in. Proud friend and mental health advocacy member. Hello, hello. All right. Thank you. Thank you all so very much. We are going to end the podcast here. As usual, I want to leave all of my listeners and viewers with love and light. And remember to be a beautiful week. Goodbye, everybody.